Antibiotics are this incredible discovery and invention of the 20th century. It has allowed us to eradicate so many infectious diseases, and it's really an essential part of modern life. But the scary thing is that because the way antibiotics work and because of the development of superbugs, because this is the resistance to be able to fight infections over time, if you get an infection or an infectious disease or an infection in a hospital, you're going to get an antibiotic. The challenge is, because resistance develops over time, that these antibiotics could actually be rendered ineffective, and in many cases are. So if you or a family member, if you have a personal experience with this, have to have a fairly routine surgery, a C-section or a hip replacement, or if you're a cancer patient and need to get chemotherapy, even a root canal, antibiotics could be rendered ineffective in situations where resistance has taken over. This is a frightening, it's a scary challenge that we all have to face, and that's why we recognize that we all have a role to play. We have these 20th century inventions like antibiotics. We have sanitation that has helped us tackle this modern medicine, but we don't want that rendered ineffective, and we have to have new strategies to fight AMR. So the partnership with the AMR Industry Alliance and BSI has been really wonderful in terms of how we step up as leaders in this space. We recognize where action can be taken to codify that, to help those who are manufacturing antibiotics, those who are in this space, to recognize that every little bit will make a difference in terms of tackling AMR and having an impact on the estimated up to 10 million deaths that we will have because of AMR. The misuse or overuse of antibiotics is a huge challenge in humans and can be for animals as well. The hygiene and sanitation challenges we see in many places around the world. If there's not great sanitation, then AMR can spread. And because there's a need for more research to develop novel and new antibiotics, because we need to have a line of defense in the antibiotic space to fight these infections. So in many cases, the first line antibiotic may not be able to fight this infection that has become resistant, the superbugs that have become resistant. So we need to go to the next line of antibiotics, and we don't want that pipeline to run out. So we need more in terms of novel antibiotics as well.